Good afternoon, everyone. This is Dr. Bhupesh once again for you all. Today is Monday. It's the first question I'm doing after Saturday and Sunday. So, obviously, I would be a little slow, but again, it's a very important question to be discussed. That's why I'm recording it again. It would be in the previous recordings as well. So, you have asked me question number 4. See, that is what it is all about. See, now I will read it. The British study team favored cervicography over smear tests, even though. Now, the question is typical. Okay. So, people prefer ice creams over hot things, hot coffee. No, something. So I will take another example. Means I want to tell you about like yeah, people love to buy Mercedes even though. So when I say people love to buy Mercedes even though it is expensive, means I am trying to find something negative. I am trying to find something negative. So the tone of my question is negative. In the same way, now I will study for you. I will read it for you. The British study team favored cervicography even though. That means we have to find a negative point about cervicography. You could have made this question very simple by understanding this phenomena. The team favored cervicography over smear test, even though cervicography had some problems. So I have to find something negative about cervicography. Once I understand this thing, this question becomes a cherry cake walk. How does this cervicography compare to the smear test? So these were the two tests, smear test and cervicography. So cervicography is favored, is preferred, even though so doctors in the US studied 3,000 patient and will smear all women had cervicography as well. 54 of the photographs were classified as abnormal compared with only 12 of the smears. So that means 54 cervicography had were considered as abnormal. That means cervicography is a test that will show more abnormalities as compared to smear test. So this is also something negative that, if a test is showing more abnormality, that means it is a kind of a test which makes you negative. But at the same time, when it comes to our medical profession, if something is telling more abnormalities, that test is more accurate. So this is not the complete negative point, but yes, it shows more abnormality. That is for sure. Again, I will read it for you. 54 of the photographs were classified abnormal. A British study was also encouraging. My companion until recently at the Royal Northern examined 200 women attending a clinic for this medicine. He found that cervicography picked up 98% of the abnormalities. That means if there is anything abnormal, this test will find that abnormality, as judged by the coloscopist. The conventional smear test failed to detect 58% of this, whereas the conventional means always old, old, conventional, old method of smear test failed to detect 58%. So that means this test was positive, but what we had to find something negative. Our tone was negative. So this whole paragraph is waste for us. That is how you save time. I am teaching you. That is why I am taking time. Otherwise, if I am doing it alone, it takes hardly a second because I can see finding abnormality is good in our medical profession. One disadvantage of cervicography, there is my line. If I can understand that's why I say reading question is the most important thing. One disadvantage that coloscopist is likely to call the woman in for examination if her cervix looks at all suspicious. At all suspicious means even 1% suspicious. Even if 1% suspicion is there, then women will come specially for this. 16% of okay, so that's the only line. Fewer patients would be referred. No, when the test will pick more abnormality, more patient will go to coloscopists. So not the less women, more women will go. Women without abnormalities would be referred. Yes, that can happen. That even the women who are suspicious but do not have abnormality means they are suspicious. They are a case of suspicion, but they actually do not have abnormalities would be referred to coloscopists. This is exactly the line that more women will go to the coloscopist. Suspicious movement would be more easily identified by the smear test. We were trying to find the negative thing about cervicography. So as per me, answer should be B. Again, I hope this answer is correct because I have done it many times. I will not lie you. So can you help me with this? Is the answer all right?
Yes, sir.
So are you getting my point? Some questions are solved just because we get confused. So we kind of overthink about these questions. If I could have understood just one concept, that team favored cervicography, even though it's gonna call more women. If even if woman is 1% suspicious, she will come and then she will get to know she has no problem. So that means extra rounds for the woman, and coloscopists will become more occupied without any reason. So that is the disadvantage. So that is how you do these questions. This is Dr. Bhupesh once again from Dr. BK Moit Institute. Thank you.